So, short answer for if concussion symptoms are resolvable, yes, all concussion symptoms as well as their causes are 100% resolvable, and you can become symptom-free no matter what symptoms you've had, how bad your concussion was, anything like that. Obviously, if it's bad enough that it's not just a concussion but an actual severe traumatic brain injury or a moderate traumatic brain injury, recovery outlooks look a little different there. But for concussion specifically, so an MTBI, a mild traumatic brain injury, it's 100% resolvable, and it just comes from treating the underlying causes, and then that removes the symptoms. So there's two ways you can really treat the underlying causes. The first way is making lifestyle changes, and that would be in regards to hormones, inflammation, and mental health. For mental health, it's really just doing the standard treatment that you would do with or without a concussion for certain mental health issues. If you take care of that, it will remove any symptoms that are being caused or enhanced by the mental health struggles. And then similar story with inflammation. Whether you had a concussion or not, eating a anti-inflammatory diet, just getting good sleep, not being stressed, all that stuff, the stuff that you do with or without a concussion, making those healthy lifestyle changes would get rid of any of the symptoms being caused by that area. And then same thing with hormones, diet, sleep, stress. If you need hormone replacement therapy, you could possibly do that. But yeah, that would be the first way to treat concussion symptoms / causes. And then the other way is rehab. This is the much more difficult way. This is the way that usually takes a lot longer because it has everything to do with how much your brain can tolerate and how fast it can recover. So basically with rehab, and this applies to any of the remaining causes, so blood flow, cognition, eyes, neck, vestibular, finding to the point that you can tolerate, and then pushing to that point, and then pulling back and resting, and then repeating that cycle over and over again, being sure that you're not overdoing it when you're working, and making sure that you're not underdoing it when you're resting. Finding that perfect balance is what helps you to recover. There's some nuance in there with eyes, neck, and vestibular. It's okay to push a little bit more into symptoms. That's been found in studies to be a good thing. Or with cognition, like as soon as you feel symptoms, you should pull back and rest. That's been found to be the most effective way to treat that. And then with blood flow, I think it's the same thing. Once you start feeling symptoms, pull back. So those are the two ways to treat concussion symptoms and causes. And with the proper plan and implementation and working with healthcare providers and just having the knowledge, you can 100% resolve concussion symptoms.